Hey everybody, we are here to talk about Mental Health Awareness Month, and it's actually Mental Health Awareness Week this week. My name is Sarah Herrig. I am the Clinical Program Manager for Mental Health Services here at Family Service of Roanoke Valley. I am a licensed professional counselor and a registered play therapist, and I oversee the Outpatient Counseling program.
Hi, my name is Mandy Gray, and I am the Program Manager for Mental Health Services. I oversee the community-based services, and I also provide some outpatient counseling.
You're a resident in counseling?
And I'm a resident in counseling.
Yay. That's awesome. So I just wanted to talk first just about some statistics about mental health here in Virginia. Especially during COVID, I think we've seen a really significant impact. So up to 1.5 million adults in Virginia struggle with a mental health diagnosis, and half of those diagnoses begin before the age of 14. And so, early intervention is something that's really essential, and something that's important to us here at Family Service of Roanoke Valley. 130,000 children and adolescents live with mental health diagnoses just in the state of Virginia. And of those, only 1 in 5 actually receive the help that they need. And that's for a lot of different reasons, things like lack of providers, insurance limitations, the stigma of mental health diagnoses. All of these numbers, they don't account for all the people who don't have any kind of formal diagnosis. And there's a really strong likelihood that these numbers are probably going to increase because of COVID impacts. But here at Family Service, our mission is to strengthen families, heal trauma, and restore hope. And we do that through several different services.
We want to serve the community as much of the community as we can. So we do this by providing services regardless of the client's ability to pay. We have at our disposal several grants for various populations. We have sliding scale. We also accept different insurances like private insurance, Medicaid, Medicare. And then also since the pandemic, we've been having free COVID sessions. It's 4 sessions for adults and teens, primarily over the phone or telehealth. Just so they can kind of try out counseling and see if it's a good fit for them.
Mm-hmm. And being able to link them to other services.
Yeah, exactly. Mm-hmm.
Mm-hmm. So one of the ways that we provide these services is through outpatient counseling. That's kind of that traditional therapy model that people think of. And at Family Service, we see people across the lifespan using evidence-based approaches to counseling. We really want to focus on the strengths of our clients through a trauma-informed lens. And so when we're meeting with our clients, we keep in mind what's happened to them rather than what's wrong with them. However, even though we provide services to people across the lifespan, our strengths really lie in our ability to provide mental health services to kids and families. And so our in-office outpatient counseling program for kids, adolescents, and families addresses a wide variety of mental health concerns. That includes things like trauma, both big T and little t, attachment disruption, childhood behavioral concerns, and we do that in a developmentally appropriate way, using services like play therapy, expressive arts therapy, sand tray, as well as other approaches that we feel like clients may need as we see them. We also have a lot of staff who are trained in eye movement desensitization and reprocessing, which is EMDR therapy. And that helps immensely for those who are struggling with the effects of trauma, but also for many other mental health concerns that might arise.
For community counseling, we have several options. One is in-home counseling, in which we actually come into the home and meet the families where they are to work on the relationships and whatever difficulties they may be experiencing. We also have non-clinical services, which are parent aid services. And that is really tailor-made to fit with that family. Sometimes it's linking them to additional services and supports. It could be helping educate the guardians on developmental milestones, what to expect in their children. Or it could be helping with scheduling and budgeting. And then one of the other things we have is the Therapeutic Day Treatment. Currently, that is in several of our after-school sites. And the clinician works with children on social skills, peer relationships, and increasing their focus to make them be more successful while they're in school. And then something else exciting that we have is we have the ability to work with certain agencies and have contracts where the services are tailored to that certain population. It could be in community settings such as schools or in housing neighborhoods.
So regardless of the service that, we're providing to you, here at Family Service, we want you all to know that, we see clients as a whole person, and we know that you ultimately are the one who knows what you need to heal. And even if you don't believe that yet, our hope is that through our strengths-based services, you will. And we want to know what you want your life to be like.
We also want to know how we can help you get the life that you want, whether that is meeting you literally in your home, in your school, in the community, or whether that is coming to the office and us providing that safe atmosphere for you.
So if you want to access our outpatient counseling services, you can contact our intake specialist, Audra Moore, and her phone number is 540-795-4653. You're also more than welcome to give me a call to discuss what service might be best for you or your family, and my number is 540-795-4699.
And if you'd like to hear more about our community programs, feel free to reach out to me at 540-795-4646. And you can also check us out on social media via Facebook, Instagram, or Twitter at Family Service RV.
Thanks, everybody.
Thank you.